insight into the incredible potential of umbilical cord blood stem cells.
The actor also very susah.
I'm expecting my little one in 2 months. The advice about cord blood banking is all over the place. What should I do? I want to make an informed decision. Time to ask the experts. And now we are here at Somewhere Medical Center. Let's seek for some experts' advice. Let's see who we should go with. Let's go with Dr. Najib then. Hi Dr. Najib, I'm Wendy. Nice to meet you. Thank you for seeing me today.
Hi Wendy, I'm Dr. Najib. I'm a pediatric hemato-oncologist and pediatric stem cell transplant hematologist here in Sunway Medical Center, Sunway City. I will be happy to answer all your questions about cord blood.
Can you explain what cord blood stem cells are and how they are used in medical treatments?
So cord blood stem cells are blood cells that are found in the umbilical cord and placenta of newborn babies. These cells are very valuable because they can differentiate into red blood cells, platelets, and white blood cells. There are 2 types of cord blood stem cells, namely hematopoietic stem cells as well as mesenchymal stem cells. Hematopoietic stem cells can differentiate into red blood cells, platelets, and white blood cells, and they are used in transplant to treat conditions such as leukemia, primary immunodeficiencies, and metabolic disorders. Mesenchymal stem cells, on the other hand, can differentiate into fat cells, bone and cartilage, and there are a lot of studies going on to research their potential in regenerative medicine as well as tissue repair.
I see. So, how do cord blood stem cells differ from bone marrow stem cells?
So cord blood stem cells are collected from the umbilical cord once the baby is born. It is a safe and painless procedure for both the baby and the mother. On the other hand, bone marrow stem cells are collected from the donor's hip bone when the need arises. This is done under general anesthesia in the operation theatre. Both bone marrow and umbilical cord contain hematopoietic stem cells, while mesenchymal stem cells can only be found in cord blood.
How do cord blood transplants differ from other treatments?
Cord blood stem cells, as a source of stem cell, has a lower risk of acute graft-versus-host disease due to their relatively lower number of immature T cells, which is responsible for triggering this graft-versus-host disease. Cord blood has long been an established source of stem cells for allogenic stem cell transplantation in patients requiring them.
Got it. Is it expensive to store cord blood?
So private cord blood banking in Malaysia started back in 2001, and since then it has grown by leaps and bounds. And the cost has come down considerably compared to when it first started. It now costs about 6,900 ringgit to store cord blood for 21 years, and I think this is very affordable because it works out to be 350 ringgit a year or less than 1 ringgit per day.
Looking ahead, how do you think cord blood treatments might change over the years?
So there's a lot of research now going on in hematopoietic stem cells as well as mesenchymal stem cells, and I'm confident that we will see some interesting developments in the near future.
Thank you so much, Dr. Najib, for sharing your insights into the incredible potential of umbilical cord blood stem cells.
It has been my pleasure. Thank you.
And now we're at Pandai Hospital. We'll talk to Dr. Pramita, a highly respected obstetrician and gynecologist with extensive experience in women's health. Let's go! Hi Dr. Pramita, I heard as an ONG you once collected cord blood for a patient who later used it to treat thalassemia major. How did you feel when you learned that it made a difference in their treatment?
As an obstetrician, we see miracles of birth daily. But there are still a few moments that catch our breath, especially when we see what we have advised the patient before come true and what we have advised someone actually help a new life, have a healthy life for the future. So my story goes like this. 22 years ago, I met this special couple, and during their pregnancy checkup, we actually diagnosed that both mother and father of this baby actually have got thalassemia. And during that counseling, we spoke to them about the fact that their future baby could have thalassemia major, could have thalassemia minor, or could be just normal. And towards the end of the pregnancy came all this talk about cord blood banking. And this was many years ago, at a time where cord blood banking was still very new to this country. So it was a new topic. Everyone was unsure whether it would be a good thing or not. But this fantastic couple actually went on to keep their baby's cord blood just for an insurance sake. And lucky for them, that first pregnancy went well. They have a beautiful baby girl who is now 21 years old, very healthy, no thalassemia whatsoever. 2 years down the line, she got pregnant again with her second child. This time around, very confident everything was going to go okay. She had a fantastic pregnancy. Unfortunately, that baby turned out to be a thalassemia major. And then we looked back and thought how lucky it was that we actually kept the first baby's cord blood, because that became a life-changing measure for this particular child. And her siblings' cord blood was then used to change the second girl's thalassemia major into thalassemia minor. So these things are things that we don't think about when we are pregnant. These things we hope never to happen to us. But when it does happen, and there is a way to help the next baby, we are always very thankful. So that story remains with me and will remain with me forever. And it was really good that that decision that we made many years ago actually helped that sibling become a thalassemia minor and have a healthy life ahead of her.
What are some common questions parents ask about cord blood banking?
Parents ask me a lot of questions about cord blood banking. One of the most common questions is it really necessary, doctor? Do I really need to keep my baby's cord blood for the future? It's a very difficult question to answer, but one of the things I usually tell them is that we all take insurance policies. We take them right from the very young because we want to protect ourselves. We have no idea when we would fall sick. It could be a simple pneumonia, it could be a fractured leg. We would never know these things that can happen to us. So keeping cord blood is something like that. It is an insurance policy that we have in hand. We never want to use it. We hope never to use it. But if for that small chance that we need to use it, we have something to fall back on. The next question is always that, is it going to hurt my baby to take cord blood? And I'll always tell them no, because there is no pain involved. There is no pain to the mother. There is no pain to the baby, because of the fact that this is blood that's anyway going to be thrown away. So we just draw that blood to the cord blood, and that's actually stored in the bank, and then it would be into the bag, and that's given to the cord blood authorities to take over. They also worry about the fact that, when they actually want to use that blood, would it be good blood? Would it be infected? Would it be enough? So this is where, getting to a good company that keeps the cord blood safely for you is very, very important, to ensure that whenever that you want to use it, if you need to use it 5 years, 15 years down the line, you can use it. So that's really very important. And of course, always comes this talk about cost, because of the fact that these are parents that are dealing with a new baby. So they're always counting the fact that they have the cost of the delivery, they have the cost of looking after the baby, and then you throw in the cost of keeping cord blood, which is actually a very important question that is asked. But again, I throw that back to them that, it is something that, you can think about, and I think it is a conversation that everyone needs to have, and it is a personal decision that they have to incorporate into their finances and see whether it is actually feasible for them, in that off chance that one day, if they actually need it, they have something to rely on.
Okay then, what would you say to parents who aren't sure about cord blood banking?
It is actually a very big decision, and I actually tell parents to read up more about cord blood banking. We now know that cord blood actually can help 80 over diseases. It can be used for any family member, siblings, and used very successfully. But it is still an important decision-making factor. It is also, has got a cost factor behind it. In families where there is a blood disorder like thalassemia, where there have been history of blood cancers, I am a little bit more forceful actually to make them realize that keeping cord blood is actually very important. But at the end of the day, it is something that I think it is very important for every new parent or parents of other children think about, because as we always keep saying, this is an insurance policy. We never want to use it, but if we actually need to use it, we have it in hand.
Thank you, Dr. Pramita, for sharing your experiences and insights. It's inspiring to see how you're supporting families in making informed decisions about cord blood banking. 现在我很荣幸可以和马来西亚其中一位通过脐带血干细胞移植治疗血癌的患者 Angel 和她的妈妈仲女士聊聊。Angel， 你能跟我分享一下吗？经历血癌治疗过程，脐带血是怎样帮到你的？还有现在生活有什么变化吗？
其实那个时候我还很小，然后很多事情其实我也是不太的记得了哦。可是我的家人是有一直跟我讲啦，我的弟弟的脐带血还有医生的 stem life 救了我的命。我2岁的时候被确诊为血癌，然后3岁就做了那个移植。现在我21岁，跟普通人一样健康的生活。其实我很感激现在这一切的，因为是脐带血让我有了今天的生活。
钟女士作为 Angel 的母亲，看到她走这段路，你当时是怎么样想的呢？
作为妈妈，看到孩子生病真的很难受，觉得特别无助，很害怕。当时我怀着2宝的时候，医生有建议用2宝的脐带血来帮 Angel 做移植。知道有这个选择的时候，就好像黑暗中有了希望。保存脐带血对我们家来讲，真的像是给 Angel 一个重新开始的机会。
你会对即将当父母的朋友们说些什么，来表达保存宝宝脐带血的重要性呢？
我会讲，保存宝宝脐带血真的就像为他们未来准备了一份生命的保障。希望更多的父母也可以考虑一下这个选择，这个选择是绝对不会后悔的决定。
你为什么选择了 Stem Life？ 与他们的合作体验怎么样呢？
我们选择 Stem Life 是因为信任他们的专业和支持。他们一路上都特别照顾我们，理解我们的处境，给了我们很大的帮助。在那个困难的时候 ，Stem Life 真的给了我们很大的希望，我们很感激。
好的，谢谢你 ，Angel。
Thank you for choosing STEM Life, your Asia's largest network of cord blood bank.
Thanks Stem Life, I'm confident and ready. If you are expecting, consider cord blood banking. It's a meaningful way to secure your family's future. And now we're at And now at Pandai Hospital, we'll talk to Dr. Premita, a famous